Blurred vision, distorted images, or darker gray or black spots blocking your central vision. These troubling symptoms can indicate the onset of macular degeneration, the leading cause of irreversible blindness and vision loss in Americans 60 and above. So stay with us to learn what triggers this progressive degenerative eye disease and the cutting-edge treatments that can stop its advancements. By the end of this video, you'll get a clear picture of macular degeneration from causes and risk factors to diagnosis and innovative treatments to help you or someone you care about preserve their precious eyesight. Welcome to today's video. I'm Dr. Aisha Butt. Thanks for tuning into our channel. Today we're discussing macular degeneration. Let's start by understanding what macular degeneration is. Macular degeneration is the leading cause of blindness in America for ages above 55. This degenerative disease starts off by small yellow spots in the back of the eye that decreases vision, and it progressively gets worse as the patient gets older. There are two kinds of macular degeneration, a dry kind and a wet kind. 90% of the patients get diagnosed with a dry kind of macular degeneration. It can lead to complete vision loss if left untreated. Wet macular degeneration changes very quickly. The treatment for wet macular degeneration is eye injections such as Eylea or Avastin. These injections tend to stop or slow down the progression of vision loss. However, it's not really a true treatment. So unfortunately, the vision loss is irreversible and doctors cannot bring that vision back by all these treatments. The most important part is early detection and prevention. So I get asked a lot, how do my patients know, or how can they tell if they have macular degeneration or if it is getting worse? The most important thing is annual routine eye exam that includes dilated fundus exam. I like to take photos of the back of the eye called retina, and I personally show that to my patients. Let me show you. This is the optomap of the patient. And as you can see, dry macular degeneration starts off with these yellow spots in the back of the eye. As the macular degeneration gets worse, those spots progressively get larger and deeper. You can see this patient has dry macular degeneration and this one has wet because this one has already started bleeding. Before it starts to bleed, we can detect development of the blood vessels and how they start to leak. That's why over time, I bring my patients back with macular degeneration every 3 to 6 months instead of every year. So start with a routine exam. If you get diagnosed with macular degeneration, start seeing the doctor more frequently. And this is the test that I do to monitor the progression of macular degeneration. It is a special OCT with angioplex that shows me the fine blood vessels in the back of the eye. These blood vessels can be detected as early as they develop. And over time, this test can detect the changes in the back of the eye. You can see how the swelling progressively increases as macular degeneration gets worse. These tests are highly sophisticated to show us signs of macular degeneration and their progression, because I can go back to these scans and actually see progression analysis and see if there are any changes that are happening over time. There are treatment options and more commonly preventative options for my patients that we offer here at TSO. When my patients get diagnosed with macular degeneration, we definitely talk about some lifestyle changes. I tell them to quit smoking, stay away from secondhand smoking, healthy leafy green vegetables, fish oil, omega-3s, wearing sunglasses, and making sure that regular exercise is part of the routine. For my wet macular degeneration, there is co-management with retina specialists that will be injecting Avastin or Eylea or certain injections in the eye to prevent progression of vision loss. It is very important that we detect macular degeneration early on so I can start my patients on some vitamins. There are some Aridis formulas that are available such as Preservision, Tozol, and they come with a healthy amount of lutein and zeaxanthin. Those are the specific nutrients or supplements added for your eyes. And that wraps up our discussion about macular degeneration. We covered what it is, the difference between dry and wet macular degeneration, how it's diagnosed through a dilated eye exam and imaging tests, and various treatment options available from medications to surgeries. If we didn't touch on a question you have, please be sure to leave it in the comments. If you have any concerns about your vision or changes you've noticed, don't wait. Schedule an appointment with your optometrist right away. For eye issues like macular degeneration or other, the earlier it is detected, the better it is. If you like this content, please follow us and ring the bell to be notified of your future videos. Thank you for watching.